Dr. Alejandro, welcome back to the podcast.
How are you doing, Rich? All good, all good?
I'm tired from the high season. It's been crazy. Last year was like one direction, and this year's been like completely the other direction.
I know, I don't think anybody expected the avalanche of people that came down and that have been down here since pretty much the beginning of the high season, which is good on one side and could be complicated on the other side, right?
Yeah, well said. It seems like COVID kind of calmed down compared to the initial fear when we first started talking about this. But we haven't talked in a while. So can you go ahead and get us up to speed? Like what's going on with the cases? Is it calm? Is it increasing? Let's start right there.
Well, I think the country and the authorities were really surprised after in the beginning of the year where cases kind of like staled out and kind of stabilized. But there's in the last maybe week, there's been a steady growth of cases around the country, including Nosara. And I can tell you right now, according to El Observador, there's 4 active cases. There's 25 active cases and 4 new cases. But I think this is maybe not correct information yet, because just this week we've tested around 7 new positive COVID cases. That means that there's out there the probability of just those confirmed 7 cases. We're talking about maybe an extra 20 to 30 people that could potentially be infected. So I think it's time again to kind of be aware of what's happening and take the proper measures.
That's good advice. And again, just people have heard these podcasts several times before, but just remind us, where are we at with the measures as far as masks and everything? Just remind us real quick what you want people to be doing.
Reminding some of the measures would be the mandatory use of masks, washing your hands, social distancing. If you start to develop any symptoms like flu-like symptoms, headaches, back pain, runny nose, fever, difficulty breathing, and then the loss of sense of taste or smell, that would be possible indications that you have COVID. With the beginning of the rainy season, we're going to see a spike in normal flu. Still, if you have doubts, if you think or you're symptomatic, stay home as much as possible. Even if it's only a flu, that at this point it's been difficult to determine which is which, but just stay home especially if you're symptomatic.
What's going on with testing these days?
Well, the testing, the main reason people are getting tested is for travel. So since the states are allowing the use of antigen and the country authorized the use of antigen tests for travel only, that means you need to have basically a boarding ticket to get the antigen test. They're not going to make it diagnostic because it's not a really good test. It's not sensitive enough and it's not specific enough. So people going into testing for antigens, it's way faster, it's way cheaper, but it's not as specific. So because it's not specific and diagnostic, the Ministry of Health determined that if you have a positive antigen, even if you have a negative or 3 negative PCRs, you're going to stay in quarantine. So we've seen a lot of people that, try to argue or tell us a bunch of other stuff. This is not a regulation from us, and it's a regulation from the health ministry. PCR is still like the gold standard and the diagnostic tool, which is, what I would probably recommend if anybody is symptomatic, for sure. And if you want to be certain that you're not going to stay in the country, you can do PCR. There's a lot of questions regarding tests and vaccines. And if you're vaccinated, the vaccine acts differently, and it's not going to be manifested in your mucous membranes where we take the tests. So it doesn't affect, it's not going to yield any positive results just because you are vaccinated. So you can test without worries that that's going to happen.
Okay. And then as far as vaccinations countrywide, what are the ages? Who is it accessible to? Can you talk us through some updates with that, please?
So for the nationals and foreigners that are registered with Caja, you need to be registered at the device. So they've been vaccinated first line personnel like policemen and doctors and nurses and microbiologists and health personnel. And then they've been coming down from 90 years old downwards. But you need to be registered at the device, not only through Caja, but you need to be registered at the device of Nosara in order for them to give you a call. Our medical team has been vaccinated, and I can tell you we haven't grown any new eyes or scales on our body. The first dose kind of hurt my arm. The second dose, I felt a little down and kind of like not just wanted to rest, a mild, really mild headache. Took one acetaminophen and that's it. And the country is still, they brought in over 1 million dosages already, and the only vaccine that it's been used at the moment, it's the Pfizer vaccine.
Okay. As my next question is, which ones are they using? And I guess you already answered that. What else should people know?
I definitely want people to know that there's a spike in COVID cases in the area and in the country, which makes sense after spring break and Semana Santa that it would show up. That it's still, you can infect your friends and families that could be vulnerable. That's the main message out there. I wanted to throw some light into people and testing and vaccines because there's a lot of like uncertainty around it, and just how you can get vaccinated through the country. Unfortunately, at this moment, you need to be a resident and be registered at the device. If you have underlying conditions, they're going to put you on the risk group and they might give you a call before. If not, they're going to go through ages group from 90s down to 65 or 68, and then it's going to jump into the next group. I recently had a meeting with some other the Cámara Costarricense de Salud, and they were talking about maybe July, September for availability for different brands of vaccine that could be coming in commercially into the country. So for the rest of the people that are not into any of the risk groups or any of the 4 groups that the government decided, and you want to get vaccinated, there's a possibility, hopefully around from July or August to September, but it's uncertain yet.
Gotcha. So stay tuned as far as the age group and when what opens and the new stuff comes in. But in the meantime, if you do want to get on that list, get to the Abai's Clinic in Nosara and register there.
Exactly. But I just want to clear out that if you get the vaccine, doesn't necessarily mean that you cannot get COVID. What it does, it creates immunoglobulins, and there's less chance of you getting complications from COVID. The country has already seen positive COVID positive patients that have been vaccinated. So when that happens, they need to take that sample, send it to Inciensa, which is the government lab, and they need to analyze the strand so they can share with the national and the international scientific community to see which vaccines are responding to which strands. The popular one now are the Brazilian and the UK mutation, which are causing some problems in different countries, and that's why if you're from the UK, I think you're still banned from traveling to the US. So it's important to know that it's not if you get the vaccine, you could still get COVID. So the recommendations are to still follow the protocols. There's certain publications that kind of flex out some of the measures in which, if you're, let's say, in a room or in a place with vaccinated people, you could talk without your mask. And what the countries are trying to achieve is at least 80% of the population getting vaccinated to have a little bit of herd immunity. But like the flu vaccine, odds are COVID, it's also going to have variations through time, and you might need reinforcements or boosters.
All right. As always, thanks for the update, sir. Pleasure to talk to you. Thanks for keeping us safe.
Take it easy, guys. Take care, Rich.
Hey, thanks for watching this episode. We have a whole bunch of episodes on richburnham.com or my YouTube channel, Rich Burnham. And if you want audio only, go to wherever you get your podcast and check out the Nosara podcast with Rich Burnham.